the feeling of general constriction and tightness in my upper thoracic area, both on the front and the back. I have problems with ringing in the ears. It's not overly intense, but if I'm sitting alone in a silent room, and if I focus on it, it will be quite bad. It's worse on the left side than on the right. And also, I experience what I think are preventricular or preatrial contractions, PVCs. I get these facial tremors, and I get tremors that eventually build up as they're going all the way down my arms.
What's the usual trigger point that starts the tremors?
Right here is where I start to feel it, in my mouth area. Mouth, chin area, jaw area. That's where it begins.
So right now we're doing this instrumentation and we're looking for signs of inflammation and also abnormal temperature. So when the structure gets damaged, signal system is inflammation itself. It tells the body, hey fellas, we gotta go fix something here. This needs to be addressed. So one of the byproducts is heat. And that's what this device picks up. And right now it looks like we got some chronic things going on. So we're going to tilt the scope or camber it. Take a look, see what's going on in these particular areas. Now we're not saying it's definitive these areas are the definite areas that we need to correct and work on. No, that is not the case. It's just simply saying that there's an abnormal temperature at these particular levels that we need to focus and rule out with the other indicators as well. So, how's that fella right there? Not too bad?
Not too bad. It's a little tender compared to the right side.
All right. Got some pulling on this area, so how's that fella right there?
Not too pleasant.
Yeah.
Definitely some tenderness.
So this fella right here got some trouble. Mark that low.
Might have been from the fall.
Possibly. We'll take a look.
I definitely feel a bunch of cracking and popping
something
there.
going on here too.
And there.
This fella right here. Right there. Something not too long over there. Yeah. See, we got this muscle spasm and the swelling and edema right at this particular level.
Oh yeah, I felt it.
Yeah, that's that 6 cervical right there. Yeah, that's the one in trouble. All right. Let's check it out. So that's not moving too well on this side. But I bet you there's a compensation. All right. See if there's one. All right. Go ahead and open your mouth. Close. Yeah, you definitely got that TMJ on that side. Okay. Now let's take another look at something else. Just do me a favor. Go ahead. Do these two feel the same?
One more time.
Same?
I feel it more on the right side by a bit.
All
A
right.
good 10%, 20%.
Over here. How's that?
Somehow I feel it more on the right.
Okay, so then would you say that this is on the left side decreased sensation?
Decreased, and in a way that I would never have thought of it. You know, it's subtle, but it is more on the right.
Okay, so let's check these out. Let's raise these up. How about this?
Again?
The same? Or
About the same.
same? What about this?
About the same.
This?
One more time. A little bit better on the left.
Okay, what about this?
About the same. Well, perhaps better on the right.
Slight. What about this?
Same to better on the right.
How's that?
One more time. A little better on the right.
So we've got decreased nerve function going on all over the left-hand side predominantly. Okay, so this, and this. What you're saying? So
It's same. It's like so subtle, but it's a little better on the right.
yeah, so it's a little bit decreased overall. So we've got some decreased nerve function going to the left arm from there, and we're gonna take a look, see what's going on that fella. So in regards to that facial twitch you got going on, okay, so we already confirmed it on you. So you feel more sensation on the right hand side, but decreased sensation on the left hand side. Also, your whole entire arm itself, not all of it, but most of it is also decreased sensation as well. So what you're feeling a sensation right now in regards to is what we call the right over here. Okay, we got that trigeminal over here. Right, that deals with sensation, and also in regards to what's called the facial motor twitches, actually a combination of both. Okay, trigeminal nerve and also the facial nerve over here, number 7. That nerve also goes over here and innervates that section, right? So both of these components, even though yes, it goes into the brainstem over here as well, this region over here, but also in regards to the region of your neck, it usually clusters over here. So any particular structural problem in this region, the mid part of your neck, it may cause these neurological problems. I'm not guaranteeing it, but it's just based upon my professional experience. That's what we notice is that particular pattern. We're about to find out on you, and that's where we need the feedback if that truly is the case, because every person's nerve is unique and different, okay? And we're not saying everyone has the exact same nerves, okay? Yes, we do have the major ones, but when you start branching out, right, they get really subtle. So for one person, it may be that 6th cervical nerve. Another, maybe the 5th cervical. Maybe the 4th cervical nerve is causing all these problems. We're gonna start mapping out on just yourself, right? So this region over here, the mid and the lower, we're gonna take a look, see what's going on in your case. Here's the story with your case. So we tend to confirm a couple of things. You actually have one extra bone, which is pretty nifty. Most people have 5 bones in the low back, but you have a number 6 over here, right? Number 6. I tested confirmed on you, it says number 6 that's in trouble. That's what we need to address first, right? So because that instability over here, that's what you start to see. Your spine starts to go slightly to the right, the left, even more so to the right, left, right, so forth, right? So this is what we're gonna correct first. After we correct your number 6, I'm gonna double check what's going on in your second lumbar. But another thing that also we talked about earlier, I don't believe we discussed in the video during that consultation, is that you had, I believe you were horse playing around with your fellow buddies and you fell down and you had a little accident, okay? So this is what I see. We have a little damage over here, right over there. So in other words, more medical term we say is, okay, we got a little small node over there. So the nucleus pulposus shifted quite a bit and it damaged and chipped the very top part of this vertebrae over here. And we see that on the left-hand side over here as well. This may be contributing to some biomechanical instability to the rest of your spine itself. So we may need to address that. Just try to shift that nucleus pulposus back into the proper alignment. Next components, as we see over here, I see both of them. Right? We have both degenerated discs. There should be more normal spacing like this. You see over here, it's decreased here, decreased over here as well. So these two, they're in trouble that we need to address. This is what I test confirm, that we definitely need to correct today. I want to see if we need to address this one as well, either today's visit or a future visit. There's no doubt about it. The way I see it is this: your facial nerves, okay, the trigeminal, you're going to give us feedback on the following visit. if that was going to be resolved or not, or reduced or affected in any particular manner. So we actually got Dr. Martinez over here. All right. So we're going to go over X-ray strategy. This is something new. So now we're going to ask pop quiz. So when we take a look at the bigger picture with this patient over here, the very first thing I want to take a look at is, okay, what's going on at the top and the bottom? In essence, I want to see how twisted this patient is. Are we talking about in this normal alignment, or are we talking about twisted this way? Are we talking about twisted this way? We got to find out. Here's the thing here. See this? Lateral mass is wider on the right-hand side. Okay, so it'll be anterior on this side. So when we take a look at that, then that tells us that the way the atlas is moving towards this way. So for layman's terms, we're talking about the head is moving towards the left. So we have that locked in. The patient's body is turning over to the left-hand side like this. Now we take a look, okay, what's going on in this pelvis down here? Okay, so the pelvis, what do you see there, Doc?
So it kind of rotated right through there, just like that.
That's correct. So I'm looking at this over here. Okay, that gluteal full shadow, that's over to the right-hand side. This is very blade-like. Okay, so in essence, this ilium over here, okay, is going way over towards this way. So that's why this is much more blade-like, and this is getting more wider over here. And we're getting that EXS alignment. So in that, all intents and purposes, right now, this patient is all. I'm exaggerating so it's easy to understand and see. Going over to the left, and pelvis also going this way as well. So both sides going this way. So here's a problem. People can't walk this way, right? So our head, due to the rider reflex, has to be over here, even though the pelvis is this way. So how does the body compensate? We're gonna start twisting, right? But it can't stop all the way midway, what have you. So even though he's twisted up this way, part of it has to go this way. Chest over here needs to twist this way. The head got to twist that way as well. So that's what we start to see over here. The body starts to twist this way, twist that way, twist this way, that way, and this way over here. So even though you're experiencing all these, dynamic issues, including that temporary rib discomfort in the lower part of his chest over here, okay, my more immediate concern is, okay, right now he's twisted this way and that way as well. But because of that horseplay, that trauma, that's what's causing a little more to twist up in the middle as well. So we'll address this and take a look, see what's going on here. But main thing is, let's address this first. See what's going on, and then take a look what's going on that one as well. Everything else I'm also going to double check as well. And I bet you that 6 lumbar itself, that's going to be part of it, part of the problem, and we're going to double check the pelvis afterwards. Let's roll. Back shoulders, just, your back is short, right? You also have a little, one up, walk around. Okay, have a seat. Okay, you still have pressure on the nerve right there. And number 7, still in trouble. Second lumbar is coming down, so that's good. 6 lumbars cleared. Okay, so we're not going to touch that second lumbar, but the 7th dorsal. Let's get rolling. Right there. So as you saw earlier, that's why it's so vital to have less shoulders, please. That's less shoulders. So it's so over there before. The reason why I did on the x-rays, and that's what I wanted a 1-to-1 ratio as much as possible, is because we need to be very certain and sure we're on the right segment itself. Now, because of the way that nucleus pulposus on him shifted over to to that side over here, so what we need to do is take all that rotation out, and plus reset that vertebrae back onto the nucleus pulposus just right. So we have to do a PRI-T contact right in the semidorsal. So I did a finger measurements from the spinous, from the sixth dorsal spinous, which is pretty long on them. It's about this long on them right here. And I did 2 fingers width right at the tip of it, and this is 7th dorsal right over here. Okay, just relax. Just relax it a little bit. Let it go. Okay, we're just gonna pump this up a little bit. Just relax, sure. Let it drop. Oh.
Less breathlessness when coming up quickly. A definite good amount of soreness.
Well, that's expected.
Yeah.
No, we're not done yet.
But north of where you adjust, that's where the soreness is. Base of the neck now.
How's the breathing?
Free.
All right, have a seat. Yeah, still got that pressure right there. So we gotta adjust this fella. Good. See, look at that semidorsal nerve is calming down. That's just beautiful. You know, that shoulders. There you go. So that shoulders. Okay, that's kind of stuck, so pump that up before we set that fella. A little more. Get a little more deeper in that fella. Half the job done. Let it go. Just let the shoulder go. A little more. Just relax it, fella. Don't worry, good hands right here. Oh, there it is. Okay, that fella's really jammed up. I also want to know why things are happening the way they are. You mentioned about when you lost that 80 pounds, things are starting exacerbating more.
Yeah.
So here's the thing, what I see here. I can only hypothesize as a possible explanation because I don't have previous x-rays before the 80-pound weight loss. So most of the time when we're like having all the extra weight over here, it has a tendency to pull things out this way, right? So it would increase the curvature on this one over here. And as a result, your body, what it tries to do is compensate by going this way, but also like this way, right?
Yeah.
So when we start losing all that weight, the body was so used to doing this way, when it lost all that weight, it just shifted over this way. So you have a more anterior head motion as well, right? So putting more pressure over here. So now that we're starting to stabilize and work our way upwards, you may be noticing, that's what you mentioned right before, that's right after the 7th dorsal, and then this one over here, you mentioned, okay, you got a lot of soreness and discomfort here. And I bet you feel even more pressure right at the base.
I do at this point,
right?
yes.
So this is what we're going to correct. Now, I will usually love to do a circle chair correction on this one, but I'm going to let you know, because of how much chronic damage we have on this one, it's much more ideal to do this one prone. Right, shoulders. Good, I see shoulders. Just let them all drop. A little more. That was a beauty.
I feel like things are different than they were before I came to this office.
Different in what way?
A bit more of a sense of freedom, easier to stand up straight, By freedom, I mean how free this feels.
Okay, that's good.
I don't feel the same feeling of tightness here.
Mm-hmm. Okay, open mouth, close, open, close. Open, slowly close. Good, open, close. Good. Open, close. Okay, this needs a little more. Open, close.
Again.
Close. Good. Open, close.
Oh, better. Yeah. Less popping, less clicking by a good 70%. Unbelievable. Unbelievable.
It's not unbelievable. We realigned it.
Thank you.
And you're very welcome. All right, champ. So I want some feedback on the following visit. Let us know how's the trembling, the tremors doing with the jaw, okay, the lips, and also the arms, the whole time 9 yards, all right? But here's your homework in the meantime, right? I want to let you know you have a lot of significant degeneration you got going on in there in the neck. You gotta ice this out, okay? Ice it down 20 minutes, 3 times a day, right? Just give an idea how significant it is. All right, and I'll show the viewers. See, this is what normal is supposed to look like, right? And what I see in your x-rays, no, we got past this one, phase 1. We're over here, phase 2. There's quite a bit of breakdown there. And I'll show you over here. See, that's what we showed before. That's what normal is supposed to look like over there.
Yeah.
See how much decrease that height went? Okay, it's not the same height as that one. Not the same one as that one either.
No, it's a good half of it.
Actually, quite a bit more than that. It's 2/3 of it's gone already. All right. So again, it's supposed to look like this fella, and we went all the way down to here. So these two over here, they compensated, and they tried to adapt what was going on over here. But because this got compromised, and also in addition to all that weight you had before, that's why your body was doing that excessive compensation and doing like this. And now we started to stand up more. Your body's trying to readapt to what the new center of gravity is. You couldn't do that. So that helped explain why all the tremors, everything else, you start to really amplify with the weight loss. So that's a way to correct this one, a lot more deeper in there. And you're gonna give us feedback on that next following visit. Let us know. How's it come along?
Well,
All right. That's everything, champ.
I'm feeling good, Doc. Thank you very much.
Oh, you're very welcome. How's the facial twitch coming along?
Facial twitch is much improved. In fact, now when I'm at rest, it doesn't happen at all. It's and it was happening to me after meals. That's no longer happening. Your correction of the cervical spine saw to that. So that's a 10 out of 10 improvement. Well, Dr. Suh, I'm very pleased to say that since our last checkup, which was about 5 days ago, there has not even been one single skipped heartbeat in any position. Either standing, walking, laying down, you name it, it's gone. You've done a great job, and I think that adjustment that you did really, really paid off. It took a few days, I guess, for the spine to find a new groove, but once it did, you have the results that I've had for the last 4 or 5 days. So I thank you very much. And the getting up quickly out of a chair or running up a flight of stairs, the feeling of chest constriction, gone. That's enough, that was right there at the top of the list of what I wanted. TMJ is umpteen times better. Ringing in the ears has gone down. It's no longer as intrusive at night. I don't even have to sleep with a white noise generator, even in a silent room. So that's still a work in progress. But let me tell you, the things that were most bothering me are gone. So thank you.
Oh, you're very welcome. Glad to hear.
Thank you, Doctor.